Hey guys, Leela Breitman here for Homeostasis 1. Today we're going to talk about spirometry. What is spirometry, you might ask? Well, spirometry measures lung functionality by measuring lung volumes or the amount and speed of air that can be inhaled and exhaled by a patient. It is the most common pulmonary function test used today. Check out those lungs. Here's a model of a patient performing pulmonary function testing. As you can see, she's holding an airflow transducer. This will transmit and record her lung volume readings. During pulmonary function testing, we want to study, and by we, I mean pulmonologists, how a patient's lungs behave with different types of breathing. For instance, we ask our patients to take a deep breath in, inflating their lungs in the process, and then we ask them to exhale forcefully or take a deep breath out, deflating their lungs. We can also study normal breathing or quiet breathing by asking the patient to breathe normally into the airflow transducer. Let's take a look at what a readout of a pulmonary function test looks like. During normal breathing, the spirometer measures the tidal volume, sometimes written as V(t), or the volume of air displaced between normal inhalation and exhalation when extra effort is not applied. When a patient takes a deep breath in, we measure the inspiratory reserve volume, otherwise known as the maximal amount of air that can be drawn into the lungs by determined effort after normal inspiration. When the patient takes a deep, forceful breath out, we measure the expiratory reserve volume, which is known as the additional amount of air that can be expired from the lungs by determined effort after normal expiration. Okay, so I'm looking at this graph, and it looks like even after effortful expiration, there appears to be some volume of air left in the lungs. This volume is known as the residual volume. When I learned lung volumes, I had a particularly difficult time visualizing them, so we're going to use our single alveolus model to help us visualize lung volumes in spirometry. Alveoli are the site of gas exchange in the lung. Oxygen enters and carbon dioxide leaves to be breathed off during exhalation. As a disclaimer, I'm not sure how physiologically accurate this model is, but it helped me visualize these lung volumes, so hopefully it helps you too. So as you now know, during normal breathing, we measure the tidal volume, and the tidal volume is not the maximal volume that the lung can hold. During effortful inspiration, we are able to draw more air into our lungs than during quiet breathing, and we measure that extra air and call it the inspiratory reserve volume. During effortful expiration, we force volume out of our lungs, and we measure that volume that we are able to push out with effort and call it the expiratory reserve volume. Even after we have forcefully exhaled, we're not able to force all of the volume out of our lungs. The remaining volume we refer to as the residual volume. So we learned about lung volumes, and now I want to know about lung capacities. So lung capacities are calculated by adding together different lung volumes. The inspiratory capacity measures the total amount of air that can be drawn into the lungs. The vital capacity, or forced vital capacity, is the maximal amount of air that can be expired from the lungs after taking a maximum inhalation. The functional residual capacity is the amount of air remaining in the lungs after passive exhalation, and we'll return more to FRC later. Last, but certainly not least, actually the most, is total lung capacity, which measures the amount of gas in the lungs after maximal inspiration. I told you before that we would return to talk more about FRC, so here we are. Before, I said that FRC is equal to the amount of gas in the lungs after passive exhalation, and that's true, but another way of thinking about this FRC concept is as a balance of forces. So in the respiratory system, we have both expanding forces and collapsing forces, and I like to think of those as two vectors that oppose one another. In a normal person, at FRC, the expanding forces are equal to the collapsing forces and the system is static. So, in an abnormal system, the FRC can be increased, which is to say that there is a reduction in the collapsing force vector. When this is the case, the system expands. Alternatively, we can see a decrease in FRC in a system where there is a reduction in the expanding forces, and intuitively, it makes sense that the system collapses in this situation. We've talked now about a static balance of forces, but what about when there's an active process occurring? Since TLC represents the volume in the lungs after a maximal inhalation, it makes sense that in order to achieve that maximal inhalation, the muscles are acting as a force vector outward to allow the chest wall and entire respiratory system to expand. At FRC, the system is static, and so the muscles are not engaged. It's mostly the lung and the chest wall that are the important vectors. When the respiratory system is at its residual volume, the muscles have been engaged to force air out of the lungs, and therefore the vector is inward. The lungs are unique and always represent a collapsing force. This may be referred to as the recoil force of the system. The chest wall is a little bit more complicated, and at TLC, it is going to oppose the expansion of the system, and therefore represent an inward or collapsing force. For FRC, as well as for residual volume, the chest wall represents an expanding or outward force by contrast to TLC. Okay, so time for a quick recap of today's video. We spent the first part of the video talking about lung volumes, and then we looked at lung capacities and how they are calculated from adding together different lung volumes. Next, we did a deep dive into FRC, and we talked about how there are expanding and collapsing forces, and how in FRC they're equal. We talked about the role of this balance of forces with the lungs, muscles, and chest wall in TLC, FRC, and RV. Well, that just about sums it up. So I hope that this video helped you understand spirometry a little bit better. Thank you so much for joining me, and hopefully next time you see a flow volume loop or hear the word FBC, you can breathe just a little bit easier.